Good day everyone, it's Andrew Jackson at the Chiropractic Clinic, and we're going to talk about treatment. You've heard some of our videos possibly on stress, on how the body works, on the intricacies of the neck and posture and alignment and discs. I want to talk about treatment today because a lot of you see on YouTube videos cracks and clicks and all that kind of stuff. Now, really that does make a big difference, and chiropractic manipulation is very, very effective in so many ways. However, what our goal really in terms of functional health or healing is to try and change how that brain perceives those body parts. What I mean by is, if I just use my model here, if for instance we've had a whiplash and we've lost the curve in our neck, and the curve should be like that and it's like that, certain joints won't be moving well. We'll start losing lateral flexion, or we'll start feeling our joints grind and click. And when those areas don't move very well, the brain's perception of that area is going to be it's going to be muted, it's not going to be as clear. And that's similar to the brain's perception of that body part. So ultimately, as a physician, chiropractic, manual manipulator, etc., we're going to find areas of the spine that don't move well, look at the posture, look at alignment, look at the core strength, and get those areas moving better. So our treatments are threefold. We want to look at alignment and posture. We want to improve that. If you lost the curve, if you've got a twist, if you've got an antalgic gait, we want to get every vertebrae, 24 of them, moving independently, and we want to get that core strength working. And that's what we call spinal hygiene. Those three aspects are going to make your body work better. So treatment entails working on those aspects. So we'll use some soft tissue therapy, we'll use some traction, we'll use some decompression of the spine, we will use some manipulation. A lot of the time we'll use a little device to put an adjustment in. We don't have to use manipulation, big cracks of the neck if some people are a bit worried about that. But our big goal is to try and create movements in areas which are not functioning well, so the brain can perceive it. Now you probably think, well, I need to go and see the chiropractor once. What research and my clinical knowledge of 20 years is that people come here and their system has been downgraded, dysfunctional for 20, 30 years a lot of the time. And a lot of the time we have to educate them in the sense of, it's going to take a bit of time. Most people are very chronic. We say to them, look, let's just work on this over the next few months, 2-3 months. We know physiologically from medical textbooks, when you have a chronic condition, it takes 18 months for it to get better. Now, what we're saying a lot of the time is just give us a bit of time. Give us about 3 months, we'll work on it. We'll put treatments in, adjustments into that system. We'll do exercises, we'll give you lifestyle changes. And over time, treatment's going to make a big difference to your body. I hope that makes sense. So treatment will take time, and give it a chance. We can't expect symptoms to disappear in 2-3 treatments, even though the saying is symptoms are the last to show, so you've had problems for a long time, and the first to go. So don't just grade it on symptoms, grade it on functionality. Thank you very much, everyone. Examples of treatment, just so you can understand what we're going to do. This is an example of decompression of the neck. It's just a traction device. We traction it, and we're just going to put a little, Andy, you just relax there. We're going to just put a little bit of tension on here. You just relax, breathe in, 1, 2, 3, and then breathe out. So we just do a little bit of traction, depending on what the patients come in for, but this is a little bit of traction that's very, very helpful for the neck, opening the discs, opening the joints, etc. Okay, when we assess the neck or assess any of the spinal joints, we're moving the neck around, we're just looking to see how the joints are moving. During our treatment, when we find areas, we use different techniques to find out where we need to adjust, not just feeling. We use muscle tests, sometimes we'll use eye movements, we'll use leg length, etc. But if we find an area, for instance, that's very, very tight and we need to get it moving better, we're going to do a little adjustment. So we're going to just put the neck in that position. We'll tell the patient just to relax, and we're going to just do a little input like that. And you might hear a little click or crack. If you're concerned about that, we can use this device, which is called a chiropractic activator, and we just put it in at that location and just do a little bit of a very, very low force. It's very, very safe, as it all is. Thank you. What we're doing here is setting up for a low back adjustment or manipulation, depending where we're going to do it, but this is generally the setup. What we're trying to do is create traction in the spine, and then we're going to put a little bit of force through here, and like that, and you might hear a little click or crack of the joints, but we want to be specific. We don't want to just do a long axis adjustment. We want to be specific with the joint that needs adjusting to help the body heal. What we're showing here is a flexion distraction treatment, which is actually a decompression for the lower lumbar spine. This works very well for disc issues, disc prolapses, any severe pain. So what we're going to do is we're going to contact the area we need to contact, and we're going to push down, and he's going to feel a stretch in his low back. So in essence, what it's doing is opening those joints and jammed joints and discs to get some better movement in that area. And we use this quite often. It's very, very effective. It's called flexion distraction technique, basically decompressing the lower spine. Here is called an Aconia low-level laser. It's a cold laser. You don't feel anything. Surprisingly, this little thing costs £9,000. It's got a lot of research behind it. And we use it for patients, particularly with pain, but also for any kind of whiplash or trauma, concussion. That's ultimately why we brought it in. So I'm going to use it on my patient here, and you can see the red lights. And what we're going to do is use it for a few minutes on areas of pain, and we use that in our clinic quite often. This is only actually at the Heaton Mersey clinic. We have this technology. I'm going to call it an industrial massager. It's not an industrial massager, but it's pretty powerful. We use that at times as well to get the soft tissues that are spasmed to start loosening up, to get the brain a better perception of what's happening down there. So we'll use that on the patient through the spine as well. Sometimes with patients we also use what we call dry needling, which is acupuncture needles. Generally we put them in areas that we're trying to help the muscle spasm. If there's trigger points of those muscles, trigger points are where the muscles aren't moving or aren't working well, and they're building up lots of waste material that cause a lot of pain. And we use those, particularly I use them in the shoulder, maybe in the glutes quite a bit, sometimes in the spine. So you can just have a look. As an example, I'm just using it there on the erector spinal muscle, and you just pop them in. The patient doesn't feel them, and we'll maybe leave the patient there for a few minutes, depending on what we need to do. So we use all forms of therapy ultimately to help the patient function better.